I'm Dr. Danny O from Penang Adventist Hospital. I'm a plastic surgeon here, and we do a lot of cosmetic surgery nowadays. Liposuction is derived from the word lipids. Lipids means oil or fat. So liposuction is sucking out the fat from a person's body. Liposuction makes a person smaller after the fat is removed. A tummy tuck is doing the same thing but with a different procedure. In a tummy tuck, you remove the fat as well as the skin of the abdomen, and then you stitch the muscles together to flatten the stomach. Whereas liposuction does not remove any skin on the outside. There's no long incision. There are just small holes through which a hollow pipe is used to suck the fat out. In all surgery, there are complications, but very fortunately, they are very few. So in an outpatient setting, if you do 200,000 surgeries as outpatient, you will find that one person may die for many different reasons. If you do liposuction, which is usually done as outpatient, you will find that out of 200,000 people that have liposuction, about 4 will die. That has been the experience of many doctors and studies done all over the world. If you look at motorcycle deaths, it will give you a good comparison. How safe is doing liposuction versus riding a motorbike? If there are 200,000 people who ride motorbikes in Malaysia, about 50 of them will die. So if you have 200,000 people doing liposuction, 4 might die. Riding motorbike is more dangerous. 50 will die. And car accidents, if you have 200,000 cars driving on the road, about 46 people will die. That's for Malaysia. So driving a car and riding motorbike is much more dangerous than liposuction. During the liposuction, a person is first put to sleep with an IV injection. That's the way we do it here in Penang Adventist Hospital. Other places might put a tube in your throat, make you unconscious, and it's called general anesthesia. So we do it with IV sedation, and then we inject local anesthetics in the body. And when the patient is completely asleep, we then suction out the fat through small holes that are placed strategically so that they don't show up as bad scars. You can compare liposuction with removal of any organ in the body. For example, a lady who has breast cancer gets the breast removed. Can she ever grow back on her own breast? No. So, if we remove the fat from the body, it also cannot grow back. It's just like a breast. And so the result is permanent. Now, there are people who say, well, I had liposuction and grew back. The reason for that is that not every single fat cell is removed from under the skin. So if a person after liposuction eats a lot, puts on weight, then the remaining fat cells will grow bigger. But it's not only the fat cells in the area of liposuction, it's fat cells all over the body. The person who says that it came back where I had liposuction, you can be sure that they are fatter all over. So the change in shape is permanent. And if you do get fat, you get fat proportionately, not only in the area where liposuction has been done. You have to take into consideration, anytime you go for cosmetic surgery, you are normal. You want to look better than your normal self. And so there are always small risks that you take. And you have to understand the risks by talking to the doctor and measuring the risk according to your sensitivity to risk. If it is more risk than you want to take for a slight improvement, you might not want to. But if it is for a big improvement, maybe you want to take a bigger risk. So it's always a comparison of risk versus benefit. And the doctor will advise you in whether you are a good candidate based on whether you have any pre-existing medical problems, like you have a heart problem or severe high blood pressure or diabetes or something, and will advise you whether you're a good candidate or not. So listen to your own self as well as risks and benefits, and then also listen to the doctor, and together you can come to a conclusion whether you want the surgery or not.